This is a special report from ABC News Digital.
I'm Dan Kleffler in New York with this ABC News Digital special report. The Affordable Care Act, known colloquially as Obamacare, is under fire again. And so today the president will take his case to the public, highlighting a provision that requires insurers to use more of your money on health care costs. Yesterday, the House voted to repeal and delay parts of the health care law, the 38th time, in fact, they've done so. As it stands, the main component of the Affordable Care Act will not go into effect until the beginning of 2014, but the White House says people are already benefiting from other parts of the bill that have taken place. Right now, as we're waiting for the president to reach the podium, I want to bring in ABC's Mary Bruce outside the White House with a look ahead at what the president is about to say. And Mary, what is the president trying to accomplish by today's speech?
Good morning, Dan. On the surface, this is all about healthcare and the consumer, but really this is all about politics. The president is kicking off a big public push to tout the ways in which his signature healthcare law is saving Americans real money. This gives him a chance to take a stab at Republicans who still want to repeal the so-called Obamacare. You mentioned yesterday the House voted for the 38th time to try and repeal parts of that bill. This gives the president a chance to come out today and say and show Americans how they're benefiting, and also to show what would happen if Republicans wanted to take those benefits away.
And in order for him to highlight those aspects of it, he will not be alone today, correct?
That's right. The president will be joined by some Americans who say they're already benefiting from the legislation to further make the case that the real money is going back into Americans' pockets. And here they come.
And let's listen in.
Hi, my name is Morgan Terrio, and I'm from Silver Spring, Maryland. I'm here with my children, Grace and Scott. I'm self-employed, so for many years I purchased insurance on the individual market, and I got used to seeing my premiums go up and up without really knowing why. It was a little like sending money into a black hole. I didn't know where it was going. Then last summer, I got a pleasant surprise. I got a rebate check for $267 from my health insurance company. It turned out that because of the Affordable Care Act, they had to spend at least 80% of my money on health care. When they fell short of that goal, they had to reimburse me for the difference. I put the $267 I saved towards my retirement. The Affordable Care Act is working for people like me. That's why I'm honored to be at the White House today, and I'm proud to introduce our President, Barack Obama.
Thank you. Thank you very much. Thank you so much, everybody. Well, I want to thank Morgan for that introduction, and I want to thank all of you for being here. There are a couple of people that I want to make sure to especially acknowledge. First of all, the leader of the Democrats in the House of Representatives, and somebody who worked harder than just about anybody to get the Affordable Care Act into law, Nancy Pelosi. We have some outstanding members of Congress here, some mayors and elected officials who are here. I want to give a special shout out. I'm not going to introduce all of them because it would take too much time and I might miss somebody. But there is one person who's standing in front, sitting in front, who I want to acknowledge just because he has served for decades and for decades fought to make sure that everybody had affordable, accessible coverage, and we're so proud of him, John Ding. So, Congressman from Michigan. So I want to welcome everybody to the White House. Every day across the country, and certainly here in the White House, there are people who are working as we speak to implement the Affordable Care Act and to deliver the security of quality, affordable health care to more Americans. The good news is that starting October 1st, new online marketplaces will allow consumers to go online and compare private health care insurance plans, just like you'd compare over the internet the best deal on flat screen TVs or cars or any other product that is important to your lives. And you're going to see competition in ways that we haven't seen before. Insurance companies will compete for your business. And in states that are working hard to make sure that this law delivers for their people, we're seeing is that consumers are getting a hint of how much money they're potentially going to save because of this law. In states like California, Oregon, Washington, new competition, new choices, market forces are pushing costs down. Just yesterday, state officials in New York announced that average premiums for consumers who buy insurance in their new marketplace will be at least 50% lower next year than they are today. Think about that, 50% lower. So for people like Morgan who are self-employed, who have to buy on the individual market, they're suddenly going to see opportunities not just for the rebates we discussed, but also for even greater savings in their monthly premiums. So if you already buy insurance on the individual market, meaning that you don't get insurance through a big group plan through your employer, that could mean thousands of dollars a year that can go towards paying a mortgage, or putting a kid through college, or saving for retirement. And what this means is that hundreds of thousands of New Yorkers who don't have insurance will finally be able to afford it, because these exchanges, this big pool, is going to reduce the cost, and you may qualify for health care tax credits. Middle-class families will potentially qualify for these credits that will bring the cost down even more. So this is just an example of how the Affordable Care Act is doing what it's designed to do: deliver more choices, better benefits, a check on rising costs, and higher quality health care. That's what it was designed to do, and we're already seeing those effects take place. Now, I mention all this because yesterday, despite all the evidence that the law is working the way it was supposed to for middle-class Americans, Republicans in the House of Representatives voted for nearly the 40th time to dismantle it. We've got a lot of problems in this country, and there's a lot of work that Congress needs to do. Get a farm bill passed, get immigration reform done, make sure we've got a budget in place that invests in our children and our future. And yet, instead, we're refighting these old battles. Sometimes I just try to figure out why. Maybe they think it's good politics, but part of our job here is not to always think about politics. Part of our job here is to sometimes think about getting work done on behalf of the American people, on behalf of the middle class and those who are striving to get into the middle class. And so the progress that we're seeing in California and Washington and Oregon and now New York, that's progress that we want to make sure we're seeing all across the country, because there are still millions of people out there who not only want to get health insurance, but many who have health insurance who deserve a better deal and deserve the kinds of savings that the Affordable Care Act will offer. Now, if you're one of the 85% of Americans who already have health insurance, could be through your employer or through Medicare or through Medicaid, you already have an array of new benefits in place. You don't have to wait until October 1st. You're already getting benefits even if you don't know that it's because of the Affordable Care Act. You're getting better protections. You're getting more value for each dollar that you spend on your health care. And that last point, the issue of getting better value for your buck, is what I want to focus on today. For years, too many middle-class families saw their health care costs go up and up and up without much explanation as to why or how their money was being spent. But today, because of the Affordable Care Act, insurance companies have to spend at least 80% of every dollar that you pay in premiums on your health care. Not on overhead, not on profits, but on you. Now, many insurance companies are already exceeding that target, and they're bringing down premiums and providing better value to their customers. But those that aren't now actually have to reimburse you. If they're not spending your premium dollars on your health care, at least 80% of it, they've got to give you some money back. Last year, millions of Americans opened letters from their insurance companies, but instead of the usual dread that comes from getting a bill, they were pleasantly surprised with a check. In 2012, 13 million rebates went out in all 50 states. Another 8.5 rebates are being sent out this summer, averaging around $100 each. And for families like Morgan's that are working hard, every dollar counts. It makes a difference. As she said during her introduction, she'd been buying insurance on the individual market in Maryland for years. After she got a rebate for the first time, and I'm quoting Morgan now, she said, "It felt like someone was actually being held accountable for the dollars I was spending on health care." That's one of the core principles of the Affordable Care Act, holding insurance companies and providers accountable so that we all get a better deal. Dan Hart, who's here from Chicago, had read these rebates were happening, but he didn't think anything of it until he got a check in the mail for $136. And Dan's a father of two, and as any parent will tell you, those kids, they suck up a lot of money. So, am I right? Yeah, absolutely. So he used his rebate to pay some bills. Rick Shuwell and Claudia Diamond co-own a stationery store in Arlington, Virginia. They knew about the provisions of the Affordable Care Act, but Rick said, "I figured I'd never see the money." So it was a complete surprise to him when they got a rebate for $320. Put that money right back into their small business. And this is happening all across the country, and it's happening because of the Affordable Care Act. Hasn't been reported on a lot. I bet if you took a poll, most folks wouldn't know when that check comes in that this was because of Obamacare that they got this extra money in their pockets. But that's what's happening. Now, even if you don't get a rebate, even if you didn't get a rebate, there's a good chance that these reforms are helping you as well, because one easy way to meet the goal of spending 80% of every dollar on care is to charge less for your care. Now, we've got more work to do to get rising health care costs under control. And some of the gains that we've made, some of the progress we've made in slowing the rise of health care costs isn't always passed on to workers. Sometimes companies may keep it, and they are charging their employees a higher copay or higher deductible, or in some way shifting some costs onto some workers. But generally speaking, what we've seen is that healthcare costs have slowed drastically in a lot of areas since we passed the Affordable Care Act. We got a lot more work to do, but healthcare inflation is not skyrocketing the way it was. And because of this new rule, because of the fact that it improves the value of the coverage that you purchase, last year alone, Americans saved $3.4 billion in lower premiums. That's $3.4 billion on top of these rebates. So that's just one way this law is helping middle-class families. But it represents everything the Affordable Care Act means for folks who already have insurance. Better benefits, stronger protections, more bang for your buck. The basic notion that you ought to get what you pay for. Now, I recognize that there's still a lot of folks in this town, at least, who are rooting for this law to fail. Some of them seem to think this law is about me. It's not. I already have really good health care. It's about the dad in Maryland who, for the first time ever, saw his family's premiums go down instead of up. It's about the grandma in Oregon whose free mammogram caught her breast cancer before it had a chance to spread. It's about the mom in Arizona who can afford heart surgery for her little girl now that the lifetime cap on her coverage has been lifted. It's about the folks here today who got a little bit of relief. And I'm curious, what do opponents of this law think the folks here today should do with the money they were reimbursed? Should they send it back to the insurance companies? Do they think that was a bad idea to make sure that insurance companies are being held accountable? I know that's not what these folks think. So the upshot is the American people deserve a fair shot. They expect businesses to play by a fair set of rules. And that's why this fight is so important. Our broken healthcare system threatened the hopes and the dreams of families and businesses across the country who feared that one illness or one accident could cost them everything they'd spent a lifetime building. And step by step, we're fixing that system. It's hard. You know, this is a big country, and the healthcare industry is massive, and there are tons of providers. And so as we implement, there are going to be glitches, and there are going to be certain states that for political reasons are resisting implementation, and we're just steadily working through all that stuff. Same was true when Medicare was started. The same was true when Social Security got started. There were folks who, for political reasons, resisted implementation. But once it got set up, people started saying, this is a pretty good deal. It gives me a little more security. It's part of that basic bargain that if you work hard, if you're doing the right thing, that you can get ahead in this country, and that you can provide some basic protections for your family. And healthcare is at the heart of that. It's part of it. Affordable healthcare is not some privilege just for the few. It's a basic right that everybody should be able to enjoy. So we're going to keep fighting to secure that right, to make sure that every American gets the care that they need, when they need it, at a price they can afford. That's the America we believe in. That's what families deserve. That's what we're going to keep on working to deliver. We're going to keep on working to make sure many people around this country who are already paying premiums are getting cheaper prices, that the money's being actually spent on their health care, that you're not having to worry about the fine print, and that if you don't have health insurance, you finally are in a position to get some at an affordable price to give you and your family the kind of security you deserve. That's something everybody should support. That's not something that should be subject to politics. If the folks who have been trying to make political hay out of this thing, if they had some better ideas, I've already told them I'm happy to hear them. But I haven't heard any so far. What I've heard is just the same old song and dance. We're just going to blow through that stuff and just keep on doing the right thing for the American people. So thank you very much. All right?
Most of the provisions are not supposed to take effect until 2014, but today the president is out in front of a crowd of families touting some of the benefits of the Affordable Care Act, known commonly as Obamacare. One of those provisions that will take effect before 2014 will be in the beginning of October, where an online marketplace will be set up to compare plans for insurance premiums and plans, actually offering consumers the option to have insurance companies fight for their business and for their interest. I want to bring in ABC's Mary Bruce, who's at the White House now and been listening to this. So Mary, today's speech, was it a direct reaction then to the House voting for now the 38th time to try to repeal the Affordable Care Act?
So what you just heard was the president thumbing his nose at his opponents. He says that the Affordable Care Act is working, it's saving Americans money, and it's time for his Republican opponents to give it up already. He says that those who continue to oppose the bill need to recognize that it's working and start focusing on the other tasks at hand, the other things that need lawmakers' attention right now.
Let me ask. I'm sorry, go ahead. No, go ahead.
I was just going to say, he mentioned a lot of the different ways that we're seeing it already starting to save people money, in particular these rebates. $500 million in rebates will be sent out by insurance companies this summer. They'll go to 8.5 million Americans. The average family will see $100 back in their pocket, and that's just one of the things that the president says, one of the reasons why people need to start recognizing that this bill is really working.
The other point that the president was making this morning is that 80% of all incoming revenue from health insurance companies must be spent on health care itself, not for profits and not for any kind of operating costs. I'm interested, though, just to find out about the timing of today's speech, though. Was this already planned, or did this follow last night's vote?
You have a couple things coming together here when it comes to the timing. I think, as he mentioned, this was nearly the 40th time that the House has voted to try and repeal this act. So it does happen fairly often, but the timing of that is convenient for the White House. Also, he mentioned some states are starting to announce that their premiums are going to be less than expected or lower than expected. We saw New York announce yesterday that a lot of people could see their premiums go down by up to 50%. So that, combined with the timing of yesterday's vote, gives the president a nice opportunity to come out and tout how this bill is really working.
Now, the White House itself, in fact, chose to delay a portion of the bill affecting small businesses. Explain a little bit about that measure and how did Republicans react to that?
That's right. That was one part where we saw some Republicans cheering here. If you're a small business owner and you have at least 50 employees, the requirement to provide health insurance, that was delayed until 2014. But you have to remember that this is a long process, and you will see parts of it take effect immediately, and that's what we're seeing this summer with the rebates. You're going to be seeing your premiums going down starting next year, so this is a slow, incremental process.
I want to ask you also just about the tone of today's speech. The president did have sort of a lighthearted, candid, reflective moment when he was kind of shaking his head saying he doesn't quite understand why the House would be voting nearly 40 times to repeal some of this. Do you think the tone was a strong partisan tone? I mean, right now we've been trying to kind of look for any sense of bipartisanship in Washington, especially most recently with those 7 nominations to cabinet levels.
That's right. The president was having certainly a little bit of fun here, poking fun at some of his opponents. He mentioned those who are trying to make political hay out of this, but certainly he's doing some of that as well. Both sides are guilty of that here. The president sort of seeming in disbelief that Republicans still continue to oppose this signature health care law of his, but he's also poking fun at them, and it goes both ways.
All right. ABC's Mary Bruce at the White House. Mary, thank you for your time and for your insight. Of course, we have a complete write-up on abcnews.com on the president making a speech on some of the benefits from the Affordable Care Act set to take effect fully in 2014. For now, I'm Dan Kleffler in New York with this ABC News Digital Special Report.
This has been a special report from ABC News Digital.